141. Which roommate would be most suitable for the 6-year-old male with a fractured femur in Russell's traction? A. 16-year-old female with scoliosis. B. 12-year-old male with a fractured femur. C. 10-year-old male with sarcoma. D. 6-year-old male with osteomyelitis. 141. The answer is B. The 6-year-old should have a roommate as close to the same age as possible, so the 12-year-old is the best match. The 10-year-old with sarcoma has cancer and will be treated with chemotherapy that makes him immune suppressed. The 6-year-old with osteomyelitis is infected, and the client in answer A is too old and is female. Therefore, answers A, C, and D are incorrect. 142. A client with osteoarthritis has a prescription for Celebrex, celecoxib. Which instruction should be included in the discharge teaching? A. Take the medication with milk. B. Report chest pain. C. Remain upright after taking for 30 minutes. D. Allow 6 weeks for optimal effects. 142. The answer is B. COX-2 inhibitors have been associated with heart attacks and strokes. Any changes in cardiac status or signs of a stroke should be reported immediately, along with any changes in bowel or bladder habits, because bleeding has been linked to use of COX-2 inhibitors. The client does not have to take the medication with milk, remain upright, or allow 6 weeks for optimal effect, so answers A, C, and D are incorrect. 143. A client with a fractured tibia has a plaster-of-Paris cast applied to immobilize the fracture. Which action by the nurse indicates understanding of a plaster-of-Paris cast? The nurse A. Handles the cast with the fingertips. B. Pedals the cast. C. Dries the cast with a hairdryer. D. Allows 24 hours before bearing weight. 143. The answer is D. A plaster-of-Paris cast takes 24 hours to dry, and the client should not bear weight for 24 hours. The cast should be handled with the palms, not the fingertips, so answer A is incorrect. Pedaling a cast is covering the end of the cast with cast batting or a sock, to prevent skin irritation and flaking of the skin under the cast. B is incorrect, because pedaling the cast is done by the healthcare provider who applied the cast. The client should be told not to dry the cast with a hairdryer because this causes hot spots and could burn the client. This also causes unequal drying, thus, answer C is incorrect. 144. The teenager with a fiberglass cast asks the nurse if it will be okay to allow his friends to autograph his cast. Which response would be best? A. It will be alright for your friends to autograph the cast. B. Because the cast is made of plaster, autographing can weaken the cast. C. If they don't use chalk to autograph, it is okay. D. Autographing or writing on the cast in any form will harm the cast. 144. The answer is A. There is no reason that the client's friends should not be allowed to autograph the cast. It will not harm the cast in any way, so answers B, C, and D are incorrect. 145. The nurse is assigned to care for the client with a Steinman pin. During pin care, she notes that the LPN uses sterile gloves and tips to clean the pin. Which action should the nurse take at this time? A. Assisting the LPN with opening sterile packages and peroxide. B. Telling the LPN that clean gloves are allowed. C. Telling the LPN that the registered nurse should perform pin care. D. Asking the LPN to clean the weights and pulleys with peroxide. 145. The answer is A. The nurse is performing the pin care correctly when she uses sterile gloves and Qtips. Clean gloves are not acceptable. A licensed practical nurse can perform pin care. There is no need to clean the weights, therefore, answers B, C, and D are incorrect. 146. A child with scoliosis has a spica cast applied. Which action specific to the spica cast should be taken? A. Check the bowel sounds. B. Assess the blood pressure. C. Offer pain medication. D. Check for swelling. 146. The answer is A. A body cast or spica cast extends from the upper abdomen to the knees or below. Bowel sounds should be checked to ensure that the client is not experiencing a paralytic ileus. Checking the blood pressure is a treatment for any client. Offering pain medication is not called for, and checking for swelling isn't specific to the stem, so answers B, C, and D are incorrect. 147. The client with a cervical fracture is placed in traction. Which type of traction will be utilized at the time of discharge? A. Russell's traction. B. Buck's traction. C. Halo traction. D. Crutchfield-Tong traction. 147. The answer is C. Halo traction will be ordered for the client with a cervical fracture. Russell's traction is used for bones of the lower extremities, as is Buck's traction. Crutchfield-Tongs are used while in the hospital and the client is immobile, therefore, answers A, B, and D are incorrect. 148. A client with a total knee replacement has a CPM, continuous passive motion device, applied during the post-operative period. Which statement made by the nurse indicates understanding of the CPM machine? A. Use of the CPM will permit the client to ambulate during the therapy. B. The CPM machine controls should be positioned distal to the site. C. If the client complains of pain during the therapy, I will turn off the machine and call the doctor. D. A use of the CPM machine will alleviate the need for physical therapy after the client is discharged. 148. The answer is B. The controller for the continuous passive motion device should be placed away from the client. Many clients complain of pain while having treatments with the CPM, so they might turn off the machine. The CPM flexes and extends the leg. The client is in the bed during CPM therapy, so answer A is incorrect. Answer C is incorrect because clients will experience pain with the treatment. Use of the CPM does not alleviate the need for physical therapy, as suggested in answer D. 149. A client with a fractured hip is being taught correct use of the walker. The nurse is aware that the correct use of the walker is achieved if A. Palms rest lightly on the handles. B. Elbows are flexed 0 degrees. C. Client walks to the front of the walker. D. Client carries the walker. 149. The answer is A. The client's palms should rest lightly on the handles. The elbow should be flexed no more than 30 degrees, but should not be extended. Answer B is incorrect, because 0 degrees is not a relaxed angle for the elbows and will not facilitate correct walker use. The client should walk to the middle of the walker, not to the front of the walker, making answer C incorrect. The client should be taught not to carry the walker because this would not provide stability, thus, answer D is incorrect. 150. When assessing a laboring client, the nurse finds a prolapsed cord. The nurse should A. Attempt to replace the cord. B. Place the client on her left side. C. Elevate the client's hips. D. Cover the cord with a dry, sterile gauze. 150. The answer is C. The client with a prolapsed cord should be treated by elevating the hips and covering the cord with a moist, sterile saline gauze. The nurse should use her fingers to push up on the presenting part until a cesarean section can be performed. Answers A, B, and D are incorrect. The nurse should not attempt to replace the cord, turn the client on the side, or cover with a dry gauze. 151. The nurse is caring for a 30-year-old male admitted with a stab wound. While in the emergency room, a chest tube is inserted. Which of the following explains the primary rationale for insertion of chest tubes? A. The tube will allow for equalization of the lung expansion. B. Chest tubes serve as a method of draining blood and serous fluid and assist in re-inflating the lungs. C. Chest tubes relieve pain associated with a collapsed lung. D. Chest tubes assist with cardiac function by stabilizing lung expansion. 151. The answer is B. Chest tubes work to re-inflate the lung and drain serous fluid. The tube does not equalize expansion of the lungs. Pain is associated with collapse of the lung, and insertion of chest tubes is painful, so answers A and C are incorrect. Answer D is true, but this is not the primary rationale for performing chest tube insertion. 152. A client who delivered this morning tells the nurse that she plans to breastfeed her baby. The nurse is aware that successful breastfeeding is most dependent on the A. Mother's educational level, B. Infant's birth weight, C. Size of the mother's breast, D. Mother's desire to breastfeed. 152. The answer is D. Success with breastfeeding depends on many factors, but the most dependable reason for success is desire and willingness to continue the breastfeeding until the infant and mother have time to adapt. The educational level, the infant's birth weight, and the size of the mother's breast have nothing to do with success, so answers A, B, and C are incorrect. 153. The nurse is monitoring the progress of a client in labor. Which finding should be reported to the physician immediately? A. The presence of scant bloody discharge. B. Frequent urination. C. The presence of green-tinged amniotic fluid. D. Moderate uterine contractions. 153. The answer is C. Green-tinged amniotic fluid is indicative of meconium staining. This finding indicates fetal distress. The presence of scant bloody discharge is normal, as are frequent urination and moderate uterine contractions, making answers A, B, and D incorrect. 154. The nurse is measuring the duration of the client's contractions. Which statement is true regarding the measurement of the duration of contractions? A. Duration is measured by timing from the beginning of one contraction to the beginning of the next contraction. B. Duration is measured by timing from the end of one contraction to the beginning of the next contraction. C. Duration is measured by timing from the beginning of one contraction to the end of the same contraction. D. Duration is measured by timing from the peak of one contraction to the end of the same contraction. 154. The answer is C. Duration is measured from the beginning of one contraction to the end of the same contraction. Answer A refers to frequency. Answer B is incorrect, because we do not measure from the end of one contraction to the beginning of the next contraction. Duration is not measured from the peak of the contraction to the end, as stated in answer D. 155. The physician has ordered an intravenous infusion of Pitocin for the induction of labor. When caring for the obstetric client receiving intravenous Pitocin, the nurse should monitor for A. Maternal hypoglycemia, B. Fetal bradycardia, C. Maternal hyperreflexia, D. Fetal movement. 155. The answer is B. The client receiving Pitocin should be monitored for decelerations. There is no association with Pitocin use and hypoglycemia, maternal hyperreflexia, or fetal movement. Therefore, answers A, C, and D are incorrect. 156. A client with diabetes visits the prenatal clinic at 28 weeks gestation. Which statement is true regarding insulin needs during pregnancy? A. Insulin requirements moderate as the pregnancy progresses. B. A decreased need for insulin occurs during the second trimester. C. Elevations in human chorionic gonadotrophin decrease the need for insulin. D. Fetal development depends on adequate insulin regulation. 156. The answer is D. Fetal development depends on adequate nutrition and insulin regulation. Insulin needs increase during the second and third trimesters. Insulin requirements do not moderate as the pregnancy progresses, and elevated human chorionic gonadotrophin elevates insulin needs, not decreases them. Therefore, answers A, B, and C are incorrect. 157. A client in the prenatal clinic is assessed to have a blood pressure of 180/96. The nurse should give priority to A. Providing a calm environment, B. Obtaining a diet history, C. Administering an analgesic, D. Assessing fetal heart tones. 157. The answer is A. A calm environment is needed to prevent seizure activity. Any stimulation can precipitate seizures. Obtaining a diet history should be done later, and administering an analgesic is not indicated because there is no data in the stem to indicate pain. Therefore, answers B and C are incorrect. Assessing the fetal heart tones is important, but this is not the highest priority in this situation as stated in answer D. 158, a prima gravida, age 42, is 6 weeks pregnant. Based on the client's age, her infant is at risk for A. Down syndrome, B. Respiratory distress syndrome, C. Turner syndrome, D. Pathological jaundice. 158. The answer is A. The client who is age 42 is at risk for fetal anomalies such as Down syndrome and other chromosomal aberrations. Answers B, C, and D are incorrect because the client is not at higher risk for respiratory distress syndrome or pathological jaundice, and Turner syndrome is a genetic disorder. 159. A client with a missed abortion at 29 weeks gestation is admitted to the hospital. The client will most likely be treated with A. Magnesium sulfate, B. Calcium gluconate, C. Dinoprostone, Prometric D. Bromocristine, Perladel. 159. The answer is C. The client with a missed abortion will have induction of labor. Prometric is a form of prostaglandin used to soften the cervix. Magnesium sulfate is used for preterm labor and preeclampsia, calcium gluconate is the antidote for magnesium sulfate, and Perladel is a dopamine receptor stimulant used to treat Parkinson's disease. Therefore, answers A, B, and D are incorrect. Perladel was used at one time to dry breast milk. 160. A client with preeclampsia has been receiving an infusion containing magnesium sulfate for a blood pressure that is 160/80, deep tendon reflexes are 1+, and the urinary output for the past hour is 100 milliliters. The nurse should A. Continue the infusion of magnesium sulfate while monitoring the client's blood pressure. B. Stop the infusion of magnesium sulfate and contact the physician. C. Slow the infusion rate and turn the client on her left side. D. Administer calcium gluconate 4 push and continue to monitor the blood pressure. 160. The answer is A. The client's blood pressure and urinary output are within normal limits. The only alteration from normal is the decreased deep tendon reflexes. The nurse should continue to monitor the blood pressure and check the magnesium level. The therapeutic level is 4.0 to 8.0 mg per dl. Answers B, C, and D are incorrect because there is no need to stop the infusion at this time or slow the rate. Calcium gluconate is the antidote for magnesium sulfate, but there is no data to indicate toxicity.